We're proud that CMAX was the first established dedicated early phase clinical research facility in Australia. My name's Jane Kelly. I'm the CEO at CMAX Clinical Research. We're based in Adelaide and we're on the corner of North Terrace and West Terrace in the city. So we have a 30-year history. In fact, this year is our 30-year birthday. We were established by Faulding Pharmaceuticals, which were headquartered here in Adelaide, and we were set up as the Faulding Drug Studies Unit, only to do clinical trials for the Faulding Pharmaceuticals company. They were developing a number of generic products and products in the US and wanted control over the timelines of their clinical trials. So then in the year 2000, the whole of the Faulding company was sold to Main Logistics, and CMAX went as part of that sale. We weren't core business to the Faulding business, and we were then on-sold to a Victorian contract manufacturing organisation called IDT Australia. So we were part of the IDT company for 14 years until we were sold in 2017 to the IROM Group. IROM being a Tokyo-listed company in Japan, specialising in clinical trials and particularly clinical trials in the community. Well, there's many achievements that we have at CMAX Clinical Research over the 30 years, but I think in more recent times is just the resilience that we've shown. Staff have shown incredible hard work and resilience during COVID, and we've managed to not only survive the COVID pandemic, but actually expand both in our facility size and our staffing numbers. Well, this next year for us, because we've had such rapid expansion and rapid change and growth, is really all about consolidation. So it's about making the most of the brand new facilities that we have here in Adelaide, the dedicated staff and the breadth of knowledge and experience we have from the staff, and really looking at our processes and how we can diversify our product offering to the world. Joining Business SA has been really advantageous to our business, so it's really embedding us in the local Adelaide community business network, but also seeking advice on things like industrial relations and awards, making sure that we're kept up to date from a HR perspective, and really the networking with other businesses within the local Adelaide region. When you think about CMAX, please keep in mind, if you walk into a chemist, everything you see on the shelf has been through a clinical trial. So we're really trying to change the narrative about why people should put their hand up to be in a clinical trial. It's not coming in to be experimented on, it's actually advancing healthcare for the future. Without clinical trials, we won't have any new medicines moving into the future for our families, for our friends, for the community at large. Volunteers that take part in our clinical trials are paid for their time and inconvenience, and of course we run the clinical trials in a very highly regulated, safe environment, purpose-built facilities with lots of medical and nursing care. Every study that comes through CMAX receives full ethics approval before we move forward with it. So if anyone's interested in clinical trials or just interested in the work that we're actually doing here in Adelaide, if you could please have a look at our website, which is www.cmax.com.au.